This is Crystal Phend with MedPage Today here in Denver at the Heart Rhythm Society meeting, where Dr. Saurabh Kumar of the Royal Melbourne Hospital reported disappointing findings with the use of perioperative fish oil supplements to prevent atrial fibrillation after coronary bypass surgery.
There are several different potential mechanisms of how polyunsaturated fatty acids may reduce the risk of arrhythmias, and these have been studied in both in vitro and in vivo models. They've been shown to reduce or block several different ion channels and modulate gap junctions, thereby again reducing the ability to generate arrhythmias. Dietary omega-3 fatty acids have also been shown to augment vagal tone, have an anti-inflammatory effect, and potentially even reduce the risk of interstitial fibrosis, thereby reducing the risk of maybe atrial arrhythmias. In this intention to treat analysis, to evaluate the effects of fish oil to reduce post-bypass graft atrial fibrillation after coronary artery bypass surgery, there was no difference in the outcomes that were measured. The incidence was approximately 30% for both groups, with a p-value of 0.67. 130 patients were enrolled in this study, and there were 115 completers in the fish oil group and 119 completers in the placebo group. A Kaplan-Meier curve was done that showed no difference in the time to atrial fibrillation post-bypass graft surgery as well. A log rank test was also completed for distribution of yields and showed a p-value of 0.59. Notably, patients that were in either the fish oil or placebo group had a similar incidence of post-bypass graft surgery atrial fibrillation around post-op day number 7. The incidence ranged between 28 to 30%. There were no differences in any of the pre-specified measures that we had in the study, including hospital length of stay, perioperative myocardial infarction, stroke, bleeding, and also recurrence of atrial fibrillation after bypass graft surgery. There was also no difference in rehospitalization rates of atrial fibrillation.
While the results in this setting don't hold out much hope, Kumar cautioned that this doesn't discount fish oil's benefits in other settings.
This is the largest study to date. This is the largest multi-center study to date, I should add. There is certainly room to still study potentially other mechanisms that we addressed before. Perhaps it is a dose-response relationship. Perhaps we need just a lot more somehow to give. Unfortunately, in this country, that is not possible. By the way our healthcare system works, there's a very short turnaround time between the day of the surgical visit to the day of actually bypass surgery. It's almost impossible to do that. It may be the final end of this problem in terms of trying to figure out if there's a novel drug available that's safe and potentially easy to take. But as of right now, we don't have any more information to suggest that there's anything better than what we already have. Fish oil does not work. It has a lot of other applications and associations in terms of reduction of cardiovascular mortality, but for atrial arrhythmias, it does not seem to have any benefit.
So fish oil doesn't help prevent post-operative atrial fibrillation, but may help patients in other settings. Here in Denver at the Heart Rhythm Society meeting, I'm Crystal Phend, MedPage Today.